All right, so I am delighted to kick off our first plenary, so Plenary 1, which is entitled Indigenous Wisdom, Empowering Youth Wellness, 2 Eyes, 1 Heart. And we have 2 plenary speakers in this session. I'm going to introduce our first, and then I'm going to hand to my co-chair, Reid, who will introduce our second speaker. So our first speaker is Seren Friskie, and Seren is a Two-Spirit Equity and Engagement Specialist at Foundry BC. She's a researcher, yes, go Foundry. She's a research associate and a reproductive justice educator. She also has multiple languages here, many of which, unfortunately, I won't be able to pronounce, and you'll be able to tell us, no doubt, Seren. And she's deeply committed to advancing health, equity, justice, diversity, and inclusion, while advocating for the 2S LGBTQIA+ communities. Their work centres on reproductive health, Indigenous rights, equity, and anti-racism, advocating for gender-affirming care, and creating culturally safe health systems. Seren has worked alongside Indigenous communities to improve access to culturally safe healthcare and reproductive rights. Rooted in traditional teachings and intersectionality, they advocate for systemic change. Seren lives on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. Yeah. Welcome. Thank you.
Thanks, everyone. Just really grateful to be here, and just grateful to be, on this morning plenary, and to see, everyone across the room, and to see some of my colleagues and people I know from so many different spaces is really exciting. But my name's Seren Friskie. I'm here to talk about how centering Indigenous women transforms youth mental health care. And for me, I know Barbara kind of spoke a little bit about me. I'm mixed ancestry. I'm Cree and Stalo. My ancestral lands span from southern Alberta to the Fraser Valley in BC. I'm also a German, French, and a Brazilian with a few other roots woven in. I think growing up, actually, it's kind of funny. My teachers gave me kind of a nickname. This is in elementary school. They would actually call me like a Heinz 57, which is like a really old person kind of way to say that you're like a bunch of things, like a bunch of ethnicities and identities. And I think I didn't really think of it much at the time. It didn't really bother me. But later on, as an adult, I kind of realized, maybe you really shouldn't say that to like a child, of mixed identities and ancestries. But I think it's something a lot of mixed people get and mixed people hear. So being of multiple identities and getting to learn and reconnect with some of them, and of course, if Indigenous history in Canada or the US or whatever it is, obviously there's a lot of reconnection that people do due to things like displacement, residential school, and so on. And so it's really opened up my own worldview and gave me roots to grab onto. So I carry lived experience as a caretaker, a relative, and someone who has navigated the system firsthand as well as a young person with my own lived experience. And the way I approach this work is deeply shaped that not just by my own experiences, but the experience of my mother and my grandmother as well. I spent much of maybe age 7 to 9 in a hospital with my mom as I often watched her come home and break down after doctor's appointments, and it really just continues today. She still struggles with a lot of health issues and disability, and from not being heard and acknowledged and really even respected as an Indigenous woman. I know this is true for many Indigenous people across Turtle Island, or what is so-called Canada and North America. And their wisdom, resilience, and teachings guide me in understanding how Indigenous women hold and carry the work of care, often in ways that go unrecognized and are absolutely essential. Seeing my family pushed aside, perhaps ignored, ultimately really facing injustice in so many ways through intergenerational trauma, it really just fuels me to do this kind of work and to be here and to speak about it for sure. I also want to take a moment to recognize something really important to me here as well today. And it can be incredibly difficult and at times even feel probably uncomfortable to be present in, say, a privileged environment, to be here at this time, especially when we're discussing the needs and rights of equity-deserving communities. It's hard to speak about injustices or experiences of marginalized groups when there are ongoing atrocities and injustices unfolding in the world right now. And whether it's the crisis in Sudan, the violence in Gaza, the war in Ukraine, or any other devastating realities that are affecting people across the globe, I just want to recognize that it's incredibly heavy and difficult, and the weight can be overwhelming. And so if you're feeling that heaviness right now, I want you to know that you're definitely not alone, and it's on my mind for sure. And these global crises, combined with the ongoing struggles at home, are a lot to carry. And in these times and in these moments and in these difficult spaces, that we must do our best to recognize those most in need. And while I'm here today to speak about Indigenous women and youth and the unique challenges that they face, I'm also holding space for all those who are suffering, and I really carry them deeply within my heart. They are really not forgotten, and their pain is not out of mind. And I don't think we can really separate the struggles of different communities, nor should we. And then the fight for justice is interconnected. And the suffering of one group calls for solidarity and action for us all. So as we talk about the need for equity in Indigenous communities today, what I'm going to be talking about, let's also acknowledge the global landscape and remember that our collective work towards justice extends beyond borders. So I'll get into our next slide here and why this matters, the need for change. Thank you. I want to imagine a world where youth mental health care is designed for and by those who have been most excluded from it. What if the experiences of Indigenous women who have long been at the intersections of systemic oppression were at the heart of how we build these systems? This is not just a radical vision, but I really think it's a necessary one. It's not a mystery, I think we talked about it, but the facts are really clear. Mental health systems often fail Indigenous youth, IPOC youth, gender and sexually diverse youth, migrant youth, and so many others. Colonialism, racism, and sexism don't just shape history, they actively create barriers to access healing and support today. And these healthcare systems were never designed with Indigenous perspectives in mind. And that's why Indigenous youth and women often experience deep mistrust in care settings because of both historical and ongoing harm. I have some photos, I think, in the slide. I'm not sure if they're up here now. But the photos are of residential schools, Indian hospitals, the Tuskegee syphilis study faced by Black Americans. So how do we change this? To build a better system for all youth, we must center those most impacted. That's how we move beyond performative change and towards true equity. Solving for the most systemically oppressed benefits everyone. But I think that's could be a loaded question, like what does that mean? I think when people often say that, but so let's kind of break it down. Systems are often built with the majority, of course, those with privilege in mind, but they are designed around the assumption that one-size-fits-all solution works for everyone. Of course they don't. We know that they don't. And this approach leaves those who are most equity-deserving, like Indigenous women, struggling to access the support that they need. And in the Canadian context, Indigenous women living with a disability, like my mom, face even greater barriers. When systems aren't built with them in mind, they're forced to navigate structures that were never meant to include them. And it means more gatekeeping, more harm, fewer meaningful solutions. But here's kind of the thing. When we design for those most impacted, we create systems that really work better for everyone. Think about, curb cuts and sidewalks. They're originally designed for wheelchair users, but they also help parents with strollers, elders, cyclists, even someone rolling a suitcase. A small shift intended to remove a barrier for one group actually made the system better for all, and a lot of people benefit. That's how equity works. When we build with those most marginalized at the center, we create something stronger, more accessible, more effective for everyone. But what does it look like in mental health care? It means designing programs around Indigenous ways of healing, not forcing youth into systems that don't reflect their own everyday reality. Funding community-led solutions instead of top-down Western-imposed models. Recognizing that healing isn't just about clinical care. It's about land, it's about culture, it's about connection. It's about so many other things that so many people don't find within the Western kind of medical model. True equity isn't about making small accommodations, it's about transforming the system at its roots. So how do we reimagine youth mental health through an Indigenous lens? I think that when we think about youth mental health, we need to ask, are our current systems truly meeting the needs of Indigenous youth? And again, I think all of our stats and all of our reports and things like that over and over again, I think recognize that they don't. And so for many Indigenous young people, mainstream mental health services can feel disconnected from their day-to-day. The models used are often individualistic, clinical, heavily based in Western psychology or counseling, approaches that overlook the power of community, culture, and land and healing. But I think Indigenous knowledge really holds solutions here. Indigenous ways of knowing and being really offer holistic, strength-based pathways to mental wellness. We see this through things like relational and community-based care. Healing happens in connection with family, with elders, with peers, and the land. Indigenous youth often thrive in spaces where they feel seen, heard, and supported by those who share their experiences and their cultural background. I think Easy talked about, wanting to have young people see someone like them, giving support or providing support. That's so important. So many young people that I talk to, that's like one of the key things is like, you don't look like me, you don't really know my experiences, you don't have my experiences. I don't know if I can truly connect to you or open up to you. Land-based and ceremony-centered healing, many young people find healing through activities like culture camps, hunting, fishing, working with traditional medicines, working on the land. These practices reconnect youth with their identity and offer powerful ways to process trauma. Storytelling and intergenerational knowledge. Mental wellness isn't just about treating symptoms. It's about strengthening identity and belonging. Indigenous teachings passed down through stories help young people understand who they are, where they come from, how they fit into their community. A lot of people I've met, this one young person in particular, this one Indigenous youth, in different capacities that I work with through different organizations I'm involved with. But they shared one story kind of around this presentation. I was like, hey, I'm going to do this talk, and this is kind of what it's going to be about. And they were like, wow, that's really cool. I'd love to share a little bit. And they kind of shared with me how they felt really disconnected from their own mainstream kind of counseling solutions. They talked about sitting in an office, answering questions from a stranger, which they often had to repeat because they lived in a rural and remote community where, turnover within who they spoke to was really high. It's like trying to heal in a space that really wasn't made for you. At the time, they talked about, they had a social worker who was, really great, but they really couldn't pronounce the name of their traditional territory and their peoples. And, maybe that seems like a small thing to someone, but to a young person to feel like, I'm connected to this person, I can open up to them, I can tell them, I can share with them. Even just the idea that that person couldn't pronounce, the name of this traditional land that we're working on and we're on. And not only that, but they had to repeat it multiple times, so they didn't really learn it the first time to continue on. That made a really big impact on them, and it kind of made them step back and I don't really know if I really want to do counseling. But when they joined a culture camp, something shifted for them. They learned traditional songs, they made medicine bags, they listened to knowledge keepers. Afterward, they had told me, it was the first time I didn't feel broken. I just felt like I made sense. I felt like I made sense within the community that I was in. I made sense with the people I'm around. I made sense that, what I'm going through, and my ancestors have gone through too. I'm not alone in this. And I think we see this over and over again. When Indigenous youth have access to cultural spaces that reflect who they are, they don't just heal, they reclaim their identity and their connection and their strength. And I've been there too. I think, as a young person really growing up, especially in the kind of late adolescence, like in 16, 17, and really learning about myself and living authentically myself into my culture, recognizing my own Indigenous identity, which was so, distorted and shamed, and you feel so much internal shame and kind of lateral violence around your own identity, to really open up and to learn about yourself, that creates such a huge epiphany of change. So what needs to change? If we truly want to support Indigenous youth in mental health and substance use services, I think we need to integrate Indigenous approaches into our system of care. It can mean hiring and meaningfully supporting Indigenous staff, including elders, knowledge keepers, and Indigenous peer supporters. And I think that there's the two parts. There's hiring people, and then what does actually meaningfully supporting them look like? Because those two things, they're not the same. Expanding access to land-based, culture-based, and ceremony-based programs, ensuring they're funded is essential and not just optional programs or add-ons, oftentimes they are. Embedding Indigenous worldviews into service design, moving beyond Western clinical models to holistic approaches that recognize the importance of culture and identity. Prioritizing relational community-based care over crisis-driven short-term interventions. And I think it brings us to one kind of key question is, what's the difference between equity and justice in mental health care overall? What is the difference between, supporting young people with an equity lens versus a justice lens? And then true equity isn't just about making services available, it's about transforming systems so they reflect the reality, strengths, and needs of the youth that they are meant to serve. It also pushes us to look inward, look into a mirror, and truly analyze and reflect on who we are, our own identities, and how we are supporting or hindering decolonial practice. I think that's really important, how we look inward, because a lot of this anti-racism kind of work, people kind of do a little bit of self-reflection, but overall it's you have to give something up to truly do the work. It's not really about just, I'm learning, I'm listening and learning. It's about, what am I giving up actually, and what am I giving? So equity as a step, and then justice as a goal. I think everyone's probably seen this graphic before, so it's not really super exciting. I think there's a new graphic that I put on. That's okay. But, and the norms and notions of what just isn't always justice, as Amanda Gorman says. Justice is not a given. It's something that we actively create. What we accept as just in our systems is often far from true justice, especially for Indigenous women and youth. And in Canada, of course, the COVID-19 pandemic exposed the deep inequities in our healthcare system, particularly for Indigenous communities. And equity really just isn't enough. Equity redistributes, resources to meet immediate needs. Justice dismantles the structures that create inequities in the first place. We are not really at true justice yet. I don't know if we'll get there really, within my lifespan. I'm not sure. I hope so. But justice requires us to look inward, to recognize what we need to let go of for true change. And that can be painful, both as an individual, what are we willing to let go of? As a society, monetarily, what are we willing to let go of? We are not really good at things like boycotts, for example. We're not really good at that. People don't really try to give up their Starbucks or whatever it is that often, I think we like to say we give things up, but it's really hard, actually. And we try, but when things get a little too hard, we tend to give up. And we tend to, move away. I think we've seen that. Think of all the DEI programs just south of us that are canceled. You try a little bit, maybe for a couple years, 2020 to 2023. It's a little too hard. Maybe it costs a little too much. Okay, well, now we're going to kick that back. It's not as important anymore. Giving up the status quo is hard, but it's necessary. So equality means, giving everyone the same resources and opportunities. I think we're kind of starting to go there. A lot of organizations are kind of doing that, especially with staff. I think people like to say equity, but really they're meaning equality. We're going to give everyone the same kind of opportunity. You all get this. Equity acknowledges that not everyone starts from the same place. Some have been historically advantaged, while others have been intentionally disadvantaged. But justice really goes even further. It's acknowledgement, recognizing structural harms. It's accountability, taking responsibility for past and present injustices. It's action, providing resources in proportion to the harm done. I think a lot of times, even through government or through organizations, we're kind of only at the maybe acknowledgement, maybe we'll acknowledge a past injustice, however many 100 years ago or whatever it is. But oftentimes, that's even really difficult. And justice isn't about treating the symptoms of oppression, it's about dismantling the systems that create them. And equitable solutions are needed now, but we must push for deep systemic change so that these solutions are no longer necessary. And what does it mean for Indigenous youth and women? How do we move beyond equity to justice? Health equity efforts like increasing Indigenous representation in healthcare or offering cultural safety training or unconscious bias training, they're necessary for sure, but really they're not enough. We cannot just manage the symptoms of colonialism and systemic racism. We can't just manage, people, manage supports, manage staff. We must remove the conditions that cause harm in the first place. And what does that look like? It could be like decolonizing healthcare, shifting from Western-centric models to Indigenous-led approaches, and having Indigenous-led and built systems. Prioritize community kinship and land-based healing. It could prioritize Indigenous sovereignty, recognizing and respecting Indigenous laws and governance, addressing systemic racism, holding institutions accountable for ongoing discrimination, medical neglect, erasure of Indigenous ways of healing, investing in Indigenous-led solutions. Justice means not just reducing harm, but actively restoring what was taken. It means ensuring Indigenous youth and communities have the power to define and shape their own futures. True justice requires a shift, not just reforming healthcare, but restructuring it, dismantling it, not just inclusion and consultation, but Indigenous-led decision-making. Justice means Indigenous women and youth are thriving. They're not just surviving. And here kind of comes to our call to justice. I have maybe some photos here. They're not in this slide, but either way, I changed some photos up because I was like, I really want to showcase Indigenous women leaders who I know. And I know a few of them in this room and a few places in my colleagues who I know who are Indigenous women leaders. I think Toni Carleton is one of them. I talked about my coworkers, Erica McLean and Sydney Hamilton. All of them I feel so grateful to be working with them and being supported by them. But how do we shift power and, creating that real change? We have to start by shifting power. Indigenous women are the leaders and knowledge keepers, caregivers, and leaders within their communities. They've been historically excluded from decision-making and mental health systems. We can't keep developing policies and programs for Indigenous youth without Indigenous women and youth leading those conversations. And if we want true transformation, Indigenous women must be at every table and every decision at every level. How do we integrate healing practices? Mental health care must include land-based healing, cultural teaching, ceremony, and community connections. I feel like a bit of a, saying it over and over again, but I hope it sticks. And they aren't just alternative practices. They're proven vital forms of healing that have sustained Indigenous people for generations. Let's believe them. Let's believe them when they say, culture supports me in my healing. We have evidence of it. We do. How do we support Indigenous youth leadership? Indigenous youth are already organizing, they're already speaking out, they're already reshaping mental health care. Our role is not to lead for them, but it's to listen to them, uplift them, create space for their voices to be leaders in different spaces. Investing in Indigenous youth leadership is investing in the future of mental health care for all young people. And when we root our systems in the resilience and wisdom of Indigenous women, we create a future where no youth is left behind. And it isn't just about Indigenous youth, it's really about all youth. A system designed with Indigenous leadership at the center will be more just, inclusive, effective for everyone. And it's not about creating a world where mental health care isn't just accessible, but we want it to be truly healing. Thank you.
I'll call you in 1 minute.
You were fantastic.
Thank you, Seren. What a way to start our conference. I should have done maybe some small housekeeping before I introduce Seren. So I'm sure many of you may have questions for Seren. We're going to, we're not going to take questions now. We're going to take questions at the end of our second speaker, which we will hear from in a few moments. But if you have questions and you'd like to put a question to either of our speakers in a few moments, you can do so either through the app. Some people just don't want to stand up in a very large crowd like we are here and say their question, but you can put it in the app. And the second, if after there, you'll see on the aisles we have mics, so you can come up after the speakers have finished, and you can pose your question from there if you wish to actually engage further after they've actually given their plenaries. So I'm now going to hand over to my co-chair, Reid Adams-Beckett, if I'm correct. And we only met very briefly this morning, so I'm delighted to hand over to Reid, who's going to introduce us to our next speaker. Many thanks.
Thank you, Barbara. First of all, Seren, amazing. I sat there the entire time with a smile on my face. I'm from Australia, and what you were talking about that whole time, we relate with. It's such a big issue in Australia as well, and listening to an advocate like yourself is so inspiring. And next, I get to introduce the lovely Dr. Néhiyaw. Dr. Néhiyaw is a senior scientist at the Tsleil-Waututh Research Institute. She leverages measurement science to elevate the voices of children and youth. In 2009, she was invited to partner with a First Nation in the creation of a new measure with the aim of increasing wellness among Indigenous children and youth. She continues to strive to ensure Indigenous youth voices are at the forefront of research as the lead of the JEDI team. Through collaboration and innovation, her team has improved access to high-quality local content that informs health services planning for youth. Thank you.
Thank you. Thank you so much. I'm going to play the glasses game a little bit because I'm between glasses in terms of what I can see. So clearly, I'm not one of the fortunate people who's in that 29%. Thank you so much for having me here today. It is indeed a deep honor, and I'm very grateful to the elder who has welcomed us to this territory. I come from the traditional territory of the Anishinaabe in Northern Ontario, part of the Robinson-Huron Treaty. So I too come from stolen land. But my mission is not to change the land situation as much as it is to change the experience that dispossession of land, dispossession of culture has had, and beginning with children and youth. And my focus is typically those under 18, so I will slip into children from time to time, but I do have a message for the youth who are here today. So I want to talk about how we leverage technology to gather data and promote wellness. And I'm starting with a smudge bowl, because that grounds me in where the work began and the teachings that were gifted that enabled us to do the work that we needed to do. And this particular smudge bowl that you can see belongs to Mary Jo Wabineau, who is a colleague, a partner, a dear, dear friend, who I still actively connect with on a regular basis, because doing research with Indigenous communities is very relational. That relationship doesn't end. The project might end. The relationships are maintained. And so I'm going to give you a bit of an overview, and I'm actually going to wander over here because it's really hard to see what's on my slides because it's behind me and it's over here. So I'm going to walk around, and I don't actually think I need to play the glasses game anymore. So this is actually much better. So I'm going to tell you a bit of a story, and it's a story of a shared journey. And I believe that mental wellness is a shared journey. Oh, I guess I need to bring the clicker with me. The next thing is not going to work. I'm going to share how Indigenous ways of knowing were combined with measurement science. And that sounds like oil and water, but it wasn't. It was actually brilliant because the youth did it with us. And how we created something to amplify the voices of youth. I'm often told that we need to give youth a voice. No, 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 no. You guys have a voice. Sometimes you need a megaphone, but you have a voice. And my goal is to inspire new ideas that promote youth wellness. And I think there's lessons from the Indigenous community that apply to every community that's represented in this room. So why focus on Indigenous youth? Why are we starting the conference with Indigenous youth? Well, we're on Indigenous territory, and that's part of it. But I want to take people back to 20 years ago, which Barbara talked about 20 years ago, and starting in this field in 20 years. How many people here, and you don't have to raise your hands if you don't want to, remember the Out of the Shadows at Last report by Senator Michael Kirby? Is it just me? Oh, good, there's others. Okay, and I know it's a Canadian report, so many of you won't know about it. 2006, there are two important chapters in this book, but the key thing was they described lots of gaps in the mental health, and I put system in quotes because that was part of his message. We don't really have a mental health system. But in Kirby's report, there was chapter 6, which focused on children and youth and brought attention to the significant disadvantages they face. And chapter 14 focused on Indigenous people and reminded us that we need to focus on wellness, not illness, and we need to draw on traditional teachings and healings. That was 2006. Shortly after, 2009, UNICEF came out with a report on the state of the world's children, and there was an Aboriginal version of that was published that gave us the only real stats that exist today that focus in detail on Indigenous children and youth. It said they have some of the worst health outcomes in Canada. As a Canadian, that is an embarrassment. There are reasons for that. The biggest one is colonization. They also face barriers to accessing care, and I know all youth face barriers. They've got an additional level of barriers for a number of different reasons. Unfortunately, despite the fact that these reports are quite old, the situation hasn't gotten better, and that's why we're all here. We need to make the situation better. We need to improve mental wellness for all youth. One of the problems that was identified or that needed to be addressed if we were going to have solutions to this was the lack of access to relevant data. So I showed you reports from 2006 and 2009 because there really isn't a lot that's better that's focused on Indigenous children and youth right now that's that comprehensive. They need data. Data is an important part of the solution. We've all been part of evidence-based care. We've all been part of measurement-informed treatment. We've all had those benefits. Indigenous children and youth have not. Their services are locally planned, but they have no local data. The data is national and provincial. And so they're in the dark trying to plan for services. Data is power. And that's why we started with the problem of the data. If we can put data in the hands of Indigenous health leaders, they can understand what the current status is. They can then understand what's working and what's not working. And there's nothing wrong with finding out something doesn't work because then you do something different. And when we started our research, the mental health team was very terrified that we were going to find out that they were ineffective. It took me probably 6 months to figure out that that was a deep-rooted fear among the mental health staff in community. Once we finally found out, I said, no, if you find out that something's not working, you have control. You can change it. You can reach out for support yourself. There are lots of layers in the system, but we need to understand what's happening to the youth in order to make change. And the youth actually needed to be part of that. So my story in the community began back in 2009, and it was a request from one community, Musqueam unceded territory, which is on Manitoulin Island in the middle of Lake Huron, one of the Great Lakes. And it came from Mary Jo Wabino, who is a colleague, a dear friend, whose smudge bowl I start with most of my presentations, because I need to be grounded in where this began. She wanted to drop one stone in the water and watch the ripples of wellness extend through her community. But she's a visionary. She didn't want to do this just for her community. She wanted to start somewhere, but she wanted it to benefit all sorts of other communities. So every decision we made, we had to think about, how does that scale? How does that spread? How does it ripple across communities? So the solution was to create a new measure, which was consistent with Indigenous ways of knowing, but met the rigor of Western science. And Western science was important because she knew she was going to need money to fund changes in the mental health system in Indigenous communities. The government is always asking for data to prove it. And Seren alluded to the fact that we should not have to prove it, but Mary Jo said sometimes they force us. So if we look at the stories and we present the stories of why we need services to government for funding, the government says prove it, we think of the data as a bowl. You dig down through the stories, solid bowl. Go away, we have data. Give us the funding and let's make it happen. They wanted data, they wanted a measure that would generate local data, but that would bring the perspectives of youth to guide the local healing plan and to be relevant across Turtle Island. So we started by building relationships and trust. And anybody who's working with Indigenous communities knows this is huge. So these are some pictures that were taken of various things in community that we did with the youth over probably a span of about 5 years. It meant time in community, lots of time in community. It meant communication in various different ways. It meant transparency and humility. I certainly was not the expert in the community. I was the learner who went to understand how does this work for the youth. And respect for local protocols, which were also alluded to earlier. We were guided by elders, and Rita Corbière is still an elder that I connect with. She helped shape the work and ground it in culture. And the picture that is on the side of this screen is of the medicine lodge in the health center in Musqueam, where we started every focus group with the youth. And so they received cultural teachings and smudging and started in a good way for all of our groups. So our approach was really community-based and locally driven. It was child and youth-centric. They led it. We played with them, we listened to them, we learned from them. We prioritized their perspectives. The mental health team sometimes got a little prickly with us because the youth would say one thing and they would say another, and we'd try and make it work for both of them. And if somebody's perspective was prioritized, we let the youth win. It was about them. It needed to include them. And it was done in relationship with Musqueam unceded territory and many others. And we're continuing that work. We took a two-eyed seeing approach, and some of you will be familiar with this. It came from Elder Albert Marshall and Elder Merdina Marshall from Mi'kmaq territory in Canada, who talked about blending Indigenous ways of knowing and with Western science, and that safe space where the two overlap and there's collaboration that can happen. And we're really weaving those strands together to promote wellness. We engaged the youth. There were lots of ceremonies. There was lots of playtime. There was lots of goofy antics. But we needed to hear their perspectives, and we needed them to feel safe. We ran 6 focus groups over a period of a couple of years with 38 youth who came in, who took pictures to tell us what wellness meant to them. They labeled the pictures to give us the constructs, and those constructs then went into quadrants, and they put them on a huge 8-foot medicine wheel that the community built. And the process was guided by the elders. The youth taught us about things. I looked at this picture and I said, oh, this is about physical well-being. Obviously, it's Thunderbird Park. It is the ballpark. It is also the powwow grounds. And more importantly, the sign is in Anishinaabe. They were telling us that language is important to their wellness. That's why we needed to listen to the youth, because all of us adults in the room misinterpreted their photo. Good thing we weren't writing them down. I refused to write. I went to focus groups and said, nope, I will infuse my Western lens if I'm the one writing the labels. The youth did all of it. They were so brilliant. They showed us wellness through their eyes. They told us what not to ask, and that was really important. Don't ask us certain questions. We're not going to engage. They asked us, how did I do? They basically forced us to give back to them. They told us what they needed as results and helped us do it. We engaged the local health workers. They taught us to ask the tough questions and really listen. They showed us how much they cared because they challenged us to do better. We needed to do better for the youth. They pushed us. And they taught us how to identify youth at risk, and they promised to connect them to local supports, to the natural helpers who are powerful protectors. Then we engaged technology. It was only when the mental health staff said, but we're not going to enter any of this data. It's going to sit on a desk. Bad things are going to happen. We're not going to find out if there's youth at risk. That's not the way forward. And we said, oh, we could use technology to solve that problem. It can be our facilitator. So we put all of the questions, and there's 3 questions on the screen that the youth gave us, into what's called a progressive web app. Basically an app that will work on any device. It's agnostic to whatever it's running on. And that was what Mary Jo refers to as our happy accident, because the app created safe space for the youth. Now they had privacy. Now they could answer questions, and yes, they knew their answers would be reviewed, but it gave them safe space to have that first conversation. It gave them an inert object to have that first conversation. That was powerful. It eliminated barriers, and it gave us results in real time. So when they told us they wanted to know how they did, technology made that possible. The end product was community-led, it was grounded in culture, and it was underpinned by science. But the fact that I said underpinned doesn't mean that's the roots. The roots go deep in community, and the roots are really important. The results that we came up with were always presented to our community connections first. They were then shared with Chief and Council. If and when they approved, they got presented at conferences like this one, and then they were published. There were protocols that needed to be followed and that are still followed. So this is the story of co-creating a measure that we now share with leaders in other communities. But some of the other learnings that are important to youth mental wellness are that we do this free of charge. We don't charge communities. We don't hold the intellectual property. Seren talked about things you have to give up. We gave up the IP. It's under a Creative Commons license so that people can build on it and innovate from it and not start from scratch. The youth don't need you to go back to square one. They need you to meet them where they're at and take them upwards. We want it to promote wellness for many more youth across Canada and beyond if there's interest. Sorry, I'm just going to go back. The little logo in the bottom corner is the Creative Commons license. If you don't know about it, Google Creative Commons. It's a UK thing, but it's very helpful everywhere in the world. So today, the Anishinaabe, do we have any Anishinaabe speakers in the room? Maybe not. Oh, there's one at the back. Woo! It means, how are you? And the measure now has names in many different communities, including Khanwipe in Nunavut, which is the Inuktitut name. So the children and youth gave it a name, which is Anishinaabe. It's a self-reported wellness assessment tool that generates information for the community. But importantly is it came from the youth and it stays in community, although not entirely. Some of the data does flow through servers. We need to do that in order to produce reports. But it is all locally controlled, and before a community starts, we make sure there's a stewardship agreement that asserts their ownership of the data. So I'm going to show you the action cycle, which is how it works. And we start through the eastern door with a youth completing the measure. They then see a balance chart, which is how we show them how they did. We connect them with a local health worker who has access to information about anything they said that might be concerning. So she can also do the safety check-in and figure out if there's any real risk. When they're done their interaction and their conversation, they can upload the data to the server, which generates a report through the member portal, which informs local decision-making about what programs and services should be offered. So that's our cycle. Cycles work in Indigenous communities. And I'm going to show a few quick pictures. This is what the youth sees on a tablet, usually about a 10-inch tablet. This is what the results look like, and each quadrant represents an aspect of wellness that's part of traditional teachings. We use that to celebrate their strengths. We find the biggest piece, and we start there by saying, wow, aren't you doing well? Local health workers have a little bit more information. They know if there's any concerning responses. And that's important so that they can have a discussion to identify potential risk and to make a connection. And community leaders get the aggregated reports. We also tested this recently in Iqaluit, and they told us that the youth stayed in the room. They were shocked. They answered all the questions. Youth who don't like to engage. One of them asked their mental health worker to help connect them to an elder. She said, I've never talked to a youth about spirituality and counseling before. This is amazing. So the lessons that we've learned from all of this are to listen and follow the youth. I didn't start in this space thinking we were going to be talking about mental wellness, but that's where they took me. We've always considered what's best for the youth when we've had a tough decision to make. And my tech staff hate me because they'll say, oh, that's really hard to do. I said, yep, it's okay. The youth want it to happen, so you figure it out. They work hard so it looks easy for the youth. Lead with strengths. Every conversation with the youth starts with finding that biggest piece of the pie and celebrating that success. And to give data back in meaningful ways. So a quick reminder, as I get ready to wrap up, is that giving back to youth was through the balance chart. Giving back to local health workers was through that brief assessment, telling them what the problems were that were reported. And giving back to decision makers was the aggregated report. There's layers of reporting. As an academic, I've always had access to the data and the reports. Time to flip that on its head. The youth generated the data, they get the results first. The mental health workers are the helpers that are there to support the youth, they get it next. And then the leadership who really needs the data to plan in community will get the data. It just takes a day longer. So promoting youth wellness is a shared journey. Youth are incredibly resilient, and you guys in this room hold wisdom. And together, we can create innovative tools supported by technology to promote strengths-based conversations. A final message to the youth. Your perspectives are hugely important. Thank you for being here. You have the capacity to report on your wellness, and we need to hear you. Technology can help you tell your story of wellness, so there are opportunities there to amplify your voice, and I hope you'll co-create with us. And you are strong, and sometimes we forget to see that or to acknowledge that. Please remind us. So this is how we've blended Indigenous ways of knowing and Western science. And it's in the middle of those two where our passion lies and where we work well together. And that's why I've referred to it as two-eyed seeing, as two eyes and one heart. And I'd like to end by saying miigwech, thank you, merci. And I wish everyone a truly wonderful conference here in Vancouver.
Do you want to start?
Yep.
You could talk.
No worries. Moving on into a Q&A, just looking what questions that we have. We have one there at the moment. How can we support real alliances between different communities of colour as we try to centre voices of young people experiencing inequities?
Yeah, I could speak to that for sure. You know, one thing we did at Foundry a couple years ago that I had the privilege to lead was called the Anti-Racism Organizational Change Youth Forum. We were working on this anti-racism assessment, and you know, we heard from young people who were part of our youth advisory committee that this was important to them. That it was in 2020, and if you remember, of course, we had the devastating death of George Floyd on our news feeds. We had the In Plain Sight report in BC about Indigenous-specific racism in healthcare. We had the uncovering of graves in residential schools across Canada, which we are still uncovering. It was a devastating year for so many communities and so many people. And within that group, I think a lot of the young people found a lot of solidarity with each other. We spent that time learning from one another. We had different talks about what was going on. We talked about how difficult it was to just kind of continue on like everything's kind of like normal in school or, in their community spaces or talking with friends or family members about what's going on. I think we found a lot of solidarity together. There's a lot of other organizations that I know of, at least across Canada, that are kind of doing this. I think one organization is called Indigenous Youth Roots, and they have like a Black and Indigenous youth solidarity kind of group that comes together and talks about like the uniqueness of each community, but also the similarities. I think that's really powerful, and I think it's really important to create spaces like that for multiple different communities to come together and learn from one another and find ways that we connect, but we're also different. Yeah.
If anybody from the floor would wish to come up to have a mic where we have somebody ready to go? Yep, we do. Sorry, I'm being blinded here.
No worries.
Yeah.
I'm a little bit nervous, so I have some notes. I thought the last speaker made a really interesting comment about how one of the youth became more interested in their spirituality after learning more about youth mental health. And I was wondering, what is something we can learn from the Indigenous lens of spirituality that we can transfer into our youth mental health efforts?
Thank you for the question. I think there's a lot that we can learn from Indigenous teachings, and I think the first piece is that it isn't just one quadrant. Although we've separated them out to make sure we have questions from all of them and we can see how strong they are in each, they all really work together. So it's the fact that when you're having a bad day, you can go out and be on the land and smell the cedar and feel the coolness in the ground. And those things connect you to Mother Earth. And those things connect you to your spirituality. You can go and listen to an elder speak the language. You may not understand the language in your head, but you'll understand the language in your heart, in your body. Those pieces can help heal. So healing doesn't just take one form. It could also be, and many people in this room I'm sure do this, is when you're having a bad day, you go for a long run and you just get out there and you push your body. And by pushing your body physically, it helps your head. It helps your wellness. So I think the interrelationship and the interwovenness of the different aspects of wellness is a lever that we can use to help improve mental wellness in particular.
Thank you. And Nancy, there's another question that's come in here on the app, and it says, now for the visually impaired who have to slightly go forward, okay, so what a fantastic initiative. So I think that's to acknowledge that, which is really, really good. Have you had to do any advocacy to raise awareness with provincial health stakeholders about the validity of the children's health and well-being measure that you created? Does it, not sure the next part of it, kind of map into large, and mapping into larger data sets. So I suppose that's the really a core thing is to what extent are the data seen as valid? And I think given your approach, which is the intersection between the Indigenous knowledge and the Western science piece, I think was very important. And I'm no doubt that that was part of when you bring the rigor to the community piece being critical, but then layering in the rigor help then the data to be trusted, I'm assuming. So would you like to speak to that?
Yes, sure. And we did take the measure through all the standard reliability, validity, sensitivity, and specificity testing. Skye Barbic, who is here and a big part of the conference, actually ran the thing through rash analysis. We were thinking it was not going to fit because it was very conceptually driven by youth. Hey, the youth were brilliant. It worked amazingly. Even when you put it up to standards that weren't really aligned with the way it was developed, it has performed relatively well. And so we've got 12 papers that we've published and we share openly on our website. So communities can access them. So if they need the paper to take to government to say, here you go. And government now helps support the community to share it with a grant from the provincial government. So they got the message at the government that, yeah, there are no holes in it.
Yeah, and I think the co-creation piece, it makes it then, it has trust in the community. Yeah. So you've got the trust on both sides, and I think that's incredibly powerful, really, really powerful.
We might head back out to the floor again, up the back.
Hi, Nancy, both of you, thank you for a lovely presentation. And my question actually, Nancy, follows on from the question you've just been asked. And I'm really looking for advice here. You've gone into the community to develop a measure that's sensitive to their needs, to their environment, to what works for them. In the UK, at least, we're really being pushed by funders to use the same measures so that there's uniformity, we're all measuring the same thing. I feel really torn by that because the comparability is valuable, but it's not if it doesn't mean anything to the group that are filling it in. What's your advice here?
Very well said. It is a really difficult balance, and it's the balance that's important. And I would say there are some times that you're going to have to use the generic measure as imperfect as it is, and there are other times that you can use something that is more tailored to the needs of the community. I think you need to think about what the question is that you're trying to answer and whether you can afford to do both. Because if on occasion you can do both, then you understand the relationship and how you translate from scores on one to scores on the other, and potentially identify what the crosswalk is between those two. So it is a tension. We feel it in Canada too, where they're saying, oh yeah, we've got this study and we've got these standardized measures. The COM study in Canada is working on standardized measures across their sites, which is really important. We've got a couple sites that have more Indigenous who are saying, can we do this as an add-on? And I think that's a good fit for it. I think the tailored pieces are more important when you're trying to work with individual youth. The generic ones, when you've got huge, huge data sets that you're trying to have comparability, become the go-to. but it is a tension. Thank you for identifying that.
Amazing. Moving on back down here again, we've got a question. Much better. We've got a question coming in that says, "I love the presentation. Have the youth had feedback on expanding or adding into the assessments? Have they brought up factors that were not assessed in traditional assessment resources?"
Yeah, so we have had feedback. There are people who want to expand it, and that too is a tension, like the last question. If we expand it and we put different content in it, then the psychometric properties that have been established will not necessarily carry over. So we've done some work to figure out how much change we can tolerate before we risk the metrics, and communities are making some subtle changes. We do allow communities to change the content if the wording doesn't make sense to the youth. So one of the items that's in it talks about connection, and some communities talk about connection to nature, some talk about connection to land. Same concept, different words. Use the words that work in your community. But if you expand it too much, and communities can do what they want with it, right? It is now in a Creative Commons license. It's open source, essentially. But the app itself is restricted to what the app can control. So again, it's the balancing act.
A question before we go back to the floor for Seren and on the app here. What are some important things from your experience to meaningfully engage and support Indigenous youth in any project or initiative? So what's your core piece?
Yeah, for sure. I think that number one, just good relationship building, being able to be flexible with a young person. I remember, one person I was working with a while ago, they weren't able to come to like a monthly meeting, an evening meeting at the time, but I met them at like their local library or their local coffee shop once a month. That we had like a scheduled meet where I'd come out and I did that. There was no other young person that I necessarily did that with. It wasn't part of like my job or anything like that, but I knew I wanted to engage with them and I knew that this felt comfortable for them, so I kind of made that extra effort. So go the extra effort, go to the extra mile. Maybe that person can't come again to like another meeting or be a part of a presentation or something like that, but they just like chatting on the phone, at 8 p.m. because that's the time they can make it. That's the only free time they have. So being flexible, also acknowledging whatever state they're in. They could maybe be going through something complex at home or maybe having some issues elsewhere. How do you support them through all of that? And also just be kind of like a steady kind of rock even in their life. They know that they can, send you an email or connect with you. I think that's really important as well.
Hello. I have two questions that go together. They're for both of you. So first of all, what would you say are your first practical recommendations or action items for the Canadian mental health care based on your lived experience or the available knowledge? And then the other one is more of a zoom out question. It's, what is your vision for a new healthcare system with roots in Indigenous and Western ways of knowing through a two-eyed seeing approach?
Maybe I could start off just off the bat, your first question there. But I think in terms of my own lived experience, ultimately, I think people are the greatest knowledge keepers of their own care and their own journey. And, giving people the autonomy and power to make decisions about their own care is so important. I think I've spoken to a number of young people who are really navigating the mental health system, at least here in BC, really difficult. They're advocating daily on their care. They're trying to demonstrate, what their day-to-day looks like, and it's really difficult. And even if when they live in a rural, remote community, a lot of times that context of, they have to travel in hours, to get to some type of appointment, that's not really known to people that they're working with, in the lower mainland of Vancouver where it's easier to get around. Like the whole context of just where they live and their reality is so different. So how can we learn more about young people and learn more about people's circumstances and the difficulties and hurdles that they go through day to day to even get to that doctor's appointment, even get to that scan, whatever they need to do. But yeah, maybe I'll pass to you, Nancy.
Yeah, and I think in terms of the mental health system, one of the pieces that I would like to see learned from some of the experiences I've had is to think about the natural helpers, to not think of the healthcare system as just the certified licensed professionals. There are so many other people out there that play a role, and what we've learned is if we can do early identification of a problem through an app, we can connect them to an auntie, an elder in their community. It's close to home. They don't have to do the travel. They can handle the early stuff. When they need to travel and they need the registered psychologists, psychiatrists, that's going to involve travel, and that should be part of the system. But we need so many people in this system that we can't just rely on the licensed professionals. So peer support and all of those ancillary pieces are the secret sauce.
We've actually come to the end of our conversation. So I know there are a couple of people who wish to actually have a question. I'm sure that Seren and Nancy would be happy to answer them if you want to come up. But maybe just close out this first plenary. I think it's been fascinating. I certainly have learned a lot. And I think it's brilliant to hear both from your kind of your own perspective and then kind of the science interface perspective. So maybe we thank our plenary speakers for a really fantastic start to our conference.